Maybe it's better not to know. Um, but I'm so thrilled to have our very own and dear Dr. Michelle Kalt finally on. I say finally because I've been really interested in having you on, Michelle, for many, many months. And we are pre taping this. It's Tuesday, but it's relevant for all Thursdays. And we wanted to pre record because Michelle has to work on Thursday mornings, but that didn't mean that I didn't want to give us something to think about on a Thursday. So, welcome, Michelle.
Thank you so much, Lizzie. I'm very excited to be here and to just share knowledge and positivity and helpfulness for everything that we're all going through. And it's very funny, you said week, whatever. My goodness, it's just like there's only yesterday, today, and tomorrow. There's no Monday, Tuesday, Wednesday anymore. It just all blurs. Definitely.
You're right. And sometimes we don't even remember yesterday. Sometimes it's like, what am I doing in the next hour? But I wanted everyone to hear a little bit about how you joined Temple Emmanuel, your connection to Temple Emmanuel. I think I got to know your family in when I was training Justin for his bar mitzvah. And
yeah, I think it was one of your first bar mitzvahs. Yeah, right. And I think Justin's was one of the first bar mitzvahs you ever did, right? And today he's 18.
There you go. So just amazing. So tell us about your connection to Temple Emmanuel.
So Temple Emmanuel has been part of my family forever. I used to go to camp when I was a kid at Temple Emmanuel. And then when I was married and Freddie and I were shopping around for temples, we temple hopped everywhere. And as soon as we got to Temple Emmanuel, I was like, this is it. This is our home. And just the clergy bringing us in. And when we had kids and including us and you including us and being in the choir and my kids being in the choir and it's a home, it's a family, it's love, it's beautiful.
That's so sweet. And I've said this before, but it's because of congregants like you that we clergy can feel like we are at home. So I have always appreciated your support. Late night, Michelle's a doctor, so Michelle, what's wrong with me? I have a cough. I have this, and I can always get an answer and know that I'm going to get an honest answer.
And it's so fun. Sorry to interrupt. It's so funny because I'm double boarded in cardiology and internal medicine, but yet the questions I get usually have nothing to do with my specialty. And my friends who are pregnant will call me in the middle of the night with OB-GYN questions and, just happy to help. And if I don't know it, I'll look it up and we'll figure it out together, right? It's all about the whole community being there for each other, I think.
Absolutely. And I guarantee you know a whole lot more about those things than any Joe Schmo on the street. So still better to ask you. But I'm sure, I grew up the daughter of a doctor who people would stop all the time. And take out their foot in my dad's case. What's wrong with my foot? So I'm sure that you get the minute that people hear that you're a doctor, I'm sure that they have all kinds of questions.
Yes, when I'm like traveling in foreign countries, sometimes the taxi cab drivers will pull out other things to ask me questions about sores and things. And it's very interesting,
Oh man. Okay. So much of what we're going to talk about today, you and I have actually talked about in the past. Obviously, you're a heart doctor, and that's so much at the core of what I think your life revolves around is heart health and overall health. And if our hearts are not strong, nothing can really be strong. So we're going to start out. We're going to, you've had this journey the last 5 months of also being on the front lines of the pandemic. I remember talking to you a few weeks in, and you said that this kind of gives me chills thinking about it, but you said, I'll never forget, you said to me, well, although I'm not seeing the patients when they first come in, I'm seeing them when they have secondary heart attacks and different organ failure. And immediately I was like, whoa, that's I just never even thought about that. And now we're starting to learn that perhaps those aren't even secondary. They're a part of the virus to begin with. So we're going to start with the heart and end with being on the front lines. And you helped me create some questions. So let's talk a little bit about, well, actually, I want to know, why did you decide to become a cardiologist?
Really? Okay.
I
So
do. Yeah.
my both my parents are Holocaust survivors, and they're kid Holocaust survivors. So my mother's Hungarian. She was 13 when she was taken to Auschwitz, Mildorf, Dachau, Treblinka. My dad was 15. He's from Germany, and he actually hid. And so he was in Denmark, and the Danes were lovely to him. And then he was taken to Sweden. And then after that, he went to Israel. And his roommate in Israel was this guy named Shlomo. So when I was 16 years old, Shlomo had a heart attack, and at that time I did not like doctors. I didn't think that they really were personable or really cared about you, and so and my pediatrician was not a nice person, and so there was nothing about doctors that I liked, but I love science. So poor Shlomo had a heart attack, and my mother, my Hungarian mother, said, Michele, you're going to go meet me to go visit Shlomo in the hospital. And I said, I'm not going to go because I don't like hospitals and I just don't feel comfortable in them. And she said to me, oh my God, how can you live with yourself if he's going to die and you don't say goodbye? And I said, I'll remember him happy and healthy and being funny. So being the Jewish mother and the guilt, I went with her to the hospital. And at that time, hospitals smell like alcohol. And I remember going in, we went to the cardiac care unit, which I eventually ended up working in and training in and did my cardiology fellowship in. And we walked in, and Shlomo was hooked up to all these monitors. And as a 16-year-old kid who did not like hospitals, I just felt awful. And I went in, and I thought he was dead. And I came over, and he's like, Michele, come here. And I'm like, what, Shlomo? He goes, come closer. And I'm like, what? He goes, you must do me a favor. And I'm like, what, Shlomo? I'll do you anything. He goes, I give you $15. You smuggle me in a fat burger. And I'm like, Shlomo, you had a heart attack. I can't smuggle you in a fat burger. And he goes, $20, but that's my limit. So I started to feel very comfortable with him. And then as we were there, he coded, which means he died. So they pushed us out. The alarms went off. The crash car came in. They started shocking him. And my mom and I were in the archway of the door. And I just thought, how could someone I love hurt and I don't know how to fix them? I said, never again. I'm going to change that. I am going to know how to fix everyone I love. And that's what happened. So I decided to become a cardiologist.
I have never heard that story. I also have to say you tell it so well in your theatrical nature. And also it's funny because, Rabbi Aaron tells all of the Shlomo stories. So now we have another,
we have a true Shlomo story.
So did he code and pass away? Was that?
No, they brought him back. They brought him back, and he had a couple more fat burgers for a couple more years before he left us. Yes.
And you thought it's those fat burgers that made you have.
It's part of it. It's definitely part of it.
Yeah. So that'll bring us to our first question is, so how do we take care of our hearts and how do we prevent getting heart attacks?
That's a great question. So there's so many things that we can do to just keep ourselves healthy. And it's basically the things eating right, exercising, never ever smoking, making sure that you go to the doctor and have your blood pressure checked, your cholesterol checked, making sure you have a check for diabetes. And then if you have family history, making sure you go back to being healthy and living a healthy life. So going into a little more detail about each of those things, a lot of people smoke. We think that nobody smokes, but there are a lot of people out there who closet smoke. So for you people who are hiding it, I want you to know that one cigarette a day, just one, still increases the risk of heart attack or stroke by 30%, which is tantamount, right? And as far as exercise, the American College of Cardiology recommends that you walk a half hour a day for heart health. But if you're trying to lose weight, you should really walk an hour a day. And it doesn't have to be an hour at the same time. It can be 30 minutes twice a day. It can even be 15 minutes 4 times a day. And try to get your steps in whenever you can. If you're going to the market park far away, if you're near somewhere where there are stairs, take those stairs. And as far as eating right, we all know we should eat right. And there are so many different ways you can do it. There's not one, keto diet does work, but it's not the only way. Atkins works, it's not the only way. Weight Watchers is a great way because it gives you all that social support. There are a lot of calorie counting apps. One that I love is called Get My App, and it's a calorie counting app. If you just count calories for one day and just log everything you've eaten, you will see, oh my God, I had no idea I'm eating that many calories. So it's educational. And then trying to eat as much vegetables as you can and really So really lean proteins is the way to go. And it's amazing the difference that calories make. So once you start knowing your calories, you'll really understand. For example, lean proteins include fish, chicken, turkey. But if you take a palm size amount of fish, that is only 100 calories, which is nothing, and 23 grams of protein. So fish is great. So wonderful. If you're allowed 1,800 calories a day, then you could have 18 pieces of fish. You'll feel great. The same amount, the palm size amount of chicken is 300 calories. Still as much protein, but now, you know, you've cut out on 200 calories that you could maybe have of a splurge, right?
Right.
And the same amount of red meat is 600 calories. Everyone seems to think nuts are super healthy. Well, not if you're trying to lose weight. A handful of nuts, a good handful of nuts, 800 calories almost.
Wow.
So really, by using a calorie counting app, even if you're not going to count the calories, even if you're not going to cut down, you will learn so much by just tracking your calories for 3 days. So
I
those
recommend
things
my Fitness Pal too is what I use. My Fitness
it's
Pal, and I count by macros, which means that all calories are not created equal. Because some people think, oh, 1,800 calories, I'll just eat ice cream all day. But 1,800 calories worth of ice cream is not as good as a balanced diet. So that's
exactly.
definitely something I agree with.
And then as far as high cholesterol and you know, a lot of people don't want to take cholesterol lowering medicines, but actually statins are good medicines with good side effects. They actually, irregardless of what they do for lowering your cholesterol, they decrease your risk of heart attack or stroke by 25%. So that's a great side effect. And then making sure you don't have diabetes. And if you do have diabetes, the majority of type 2 diabetes completely can go away with weight loss and exercise completely. So back to being diet and healthy. So there are a lot of good things you can do. And if you're worried at all, you know, just talk to your doctor and they'll help out with risk factor modification. But it's easy to do.
And um, and then so God forbid that you do have a heart attack or you think you're having a heart attack. Can you give us like a 1 minute, like, you know, especially these days, we're all very anxious. Do we have coronavirus? Do we have this? Are we having a heart attack? People are having a lot of, you know, I think panic attacks. So how can you recognize the signs of a heart attack compared to all of these other things? What are something that you have to immediately call an ambulance or a doctor right away?
Yeah, great question. And this is a really hard time. So, typical angina is chest pain that feels pressure like, that is like an elephant sitting on your chest or squeezing in nature, that starts when you exercise and stops when you're at rest. So, that is typical angina. So, sometimes what happens is that chest pain does radiate down your arm. It could go to your neck, it could go to your teeth. It could even go to your shoulder blades back here. Sometimes it can be associated with nausea, vomiting, and sweating. But that's typical angina. Most people have typical angina. Sometimes women don't, but really diabetics will not have typical angina. So for a diabetic, all bets are off. Anything that feels like they could just present with tooth pain. They could just be the radiation. We've had patients that have just gone to the dentist and they thought it was their tooth, but really it was their angina.
That's a type
Also,
1 diabetic or a type 2 diabetic?
yeah, that is a type 1 diabetic.
Yeah.
Although any diabetic is at increased risk, definitely.
Right.
And then what's not chest pain from the heart? Well, 90% of the people that come in to see me for chest pain have non-cardiac chest pain. And like you said, they're afraid this is a really anxiety-laden time. So a lot of time people have muscular pain. Muscular pain is more sharp, lasting seconds.
Mm-hmm.
Anything that you can touch and you go, oh my God, that feels awful. That's definitely muscular. That's not your heart. You can relax with that. A lot of time people come in with heartburn symptoms. So heartburn symptoms happen mostly in the midline, worse on an empty stomach, better when you've eaten something because you've absorbed all that acid. But if you are at all worried, just run it by your doctor and they can help you figure out what's really heart chest pain and what's non-cardiac chest pain.
That is a lot to think about. Oh, man. Okay. But the truth is, to have a good relationship with your doctor is important so that you can track your symptoms and
Definitely.
um Okay, so now we lead to probably why a lot of people are tuning in, which is to hear a little bit. Oh, Amos is going to tune in right now. Come on, Amos. Come on here. He's going to say hi to everyone. He always he doesn't have any chest pain. So
He never.
so the question would be, so I kind of want to hear your evolution of like how you started. When did you start to see coronavirus at your hospital? When did it start to affect your day to day? I'd love to get just like a little bit of a behind the scenes. Some questions would be what in your opinion, what is the best way of avoiding getting coronavirus? You recommended a question of who is more susceptible, and can you predict who will get more serious cases of the coronavirus, and maybe some of the statistics about what percent of people are asymptomatic, and can they still be contagious? All things coronavirus right now.
Okay,
I wish I could say that it's August and we were done with it, but we obviously aren't learning our lesson right now because I don't know that I think we're in a worse position than 4 months ago, but
yeah, we definitely are. So in answer to your questions, we got the first case on March 5th on a Thursday. I will not forget. And that it was a young person. So he was a 50-year-old man who was healthy. So against everything that we had heard initially,
Right.
that you have to be sick and old. And so he was young. He was in his 50s. He had gone on a ski trip to Italy with a bunch of buddies. They all contracted it. And this poor man was in the hospital for over 60 days on a vent. He's lost all his fingers and his toes because of poor circulation, but he did survive. So he was my very first patient. So I knew at that second that our worlds were going to change and we would be in this for about 2 years. I was having Shabbos dinner the next day and I said, I have my first patient in the hospital. We are definitely not having Shabbos dinner because God forbid I'm contagious and, everybody needs to start social isolating, definitely.
From your
So
family you're talking about at this point.
yeah,
Distance from
definitely.
your
So
family.
when I come home from the hospital, I change my scrubs. I go into the back of my car. I throw on other clothing. When I come home and I sterilize my steering wheel, I sterilize myself. Before I hug my dogs or my kids, I will shower. It's really, I leave my shoes in my car. I leave them there for 3 days because that's how long it takes for the virus to come off them. So it's definitely a lot. And as far as what we can do to prevent coronavirus, it's really the things we have heard 1,000 times, but maybe if I give you a little bit more detail, you'll understand why we're doing these things. So, definitely the 5 things of wearing your mask, keeping 6 feet away from someone, washing your hands often and definitely often, not touching your face, and really staying away from crowds. So when we say wear a mask, it doesn't mean have a mask that's not covering your nose or having a mask that's at your neck, because this is a virus that is really inhaled and goes straight to the lungs. And then once it gets into your lungs, that's when it causes full body destruction through actually a disease of the blood vessels, which we didn't realize in the beginning. So you definitely want to have your nose and your mouth covered, and you want everyone out there to have their nose and their mouth covered. If you're going traveling or if you're going into a supermarket, you want a double mask. So if you're outside walking, single mask is fine. But if you're outside, if you're going inside, there are other people, you want a double mask. You want all that protection that you can get. And a shield would be even better. You can get them on Amazon. A shield is very protective because it also prevents you from touching your face as well.
But you want to wear a mask and a shield, right? Because if you don't wear the mask, then things can come. The mask sort of prevents from dripping down, but the shield. But the mask you still need in that case. I've seen a lot of people wear the shield just by itself, but it's not as helpful.
Correct. Right. The only time I would suggest wearing the shield by itself is if you are one of the people that are brave enough to go to a restaurant and you want to eat, then you can wear a shield and just tilt it up a little bit, and then you can eat. And then if the waiter comes by or something, you are still completely protected. And then as far as that 6 feet, well, we've done lots of studies where we've taken agar jars. So these are like jars that bugs grow in, like bacteria and viruses. It's nourishment for them. And we've tested how is the virus spread with one person wearing a mask, with 2 people wearing a mask, with speaking, with singing, with talking, with sneezing, at 1 foot, 3 foot, 6 feet and 30 feet. And what we have found is that certainly one mask is good. Two masks, each person wearing a mask is better. If you are wearing a mask and you speak, very little particle will get on 1 and 3 feet and almost nothing at 6 feet. So a mask is really protective. If you are singing, however, or coughing, you are emanating virus, it will go much further. If you are not wearing a mask and you sneeze, viral particles can go 30 feet. So you definitely want to wear your mask. You want to keep social distancing. And the thing about washing your hands is I see a lot of people washing their hands when they don't need to. It's good if you get into the habit of it. But the whole point about washing your hands is that if you touch a doorknob that someone else touched, if you touch a light switch that someone else touched, and then you touch your nose or your mouth, well, now the virus has an entry point into your body. What we recently found out is that the virus is very much transmitted in feces. So sorry for the verbiage, but that tells us that public bathrooms are the most contagious place. So we've tested the toilet bowl, the plunger, and the sinks handles. So if you can avoid using a public restroom, great. But if you have to go in, if you can grab a paper towel for the door, for the toilet, for the sink. But if you can't, then you definitely want to wash then. You should carry hand sanitizer with you everywhere you go. And when you wash, it definitely should be 30 seconds. You should wash this way. You should wash this way. You should wash this way. This way, you want to get your thumbs and you want to get your fingertips.
Wow.
So it's really washing. And then as far as crowds, like we all see what happened during the protests, you know, everyone was so good for a while. 2 weeks to the day after the protests, I went to work and I had 50 people in the emergency room with COVID and 2 pregnant women. And, you know, then we were really good before the protests. And then afterwards, it was really bad. We're running out of ventilators. Things are starting to calm down once again, but definitely avoid big crowds if you can as well. And then what did you ask me else?
Are you seeing certain people that are more susceptible to getting the virus? And can you predict who will get a more serious case of coronavirus?
Yeah, so definitely. So, you know, in the beginning, we said, people with comorbid conditions, heart disease, diabetes. Yes, we definitely see that, but they are definitely not the only people that are getting it. So obesity, that's a big thing. People who are really overweight, they are getting bad cases. So that is really part of it. But then we're seeing something that we believe is a genetic difference in racial distribution. So we are finding that the people who get it the most, so not the most serious cases, but the people who get it the most are 20 years old to 49 years old. Definitely by far they get it the most. And then Hispanics definitely get it the most. So in the emergency room, in my hospital, I mostly have middle-aged Hispanics. That's what I'm seeing. Now, as far as who gets it worse, really African Americans seem to get a worse case than non-African Americans. And we're not exactly sure why. We know it has to be genetic. We haven't pinpointed the exact reason for that. We also find that men are getting it more than women, but we don't think it's genetic. We find that's environmental and behavioral. That men
worse. When I see the numbers, like the county numbers, it seems to be 50-50 in terms of who is getting it. But it seems like men are not handling it, like they're getting worse cases. Is that true?
Well, what it is we find that men tend to not wear masks as much. Men tend to not social distance. I was actually in a building the other day, and this one guy walked in, and the security guard said, "Excuse me, sir, you have to put on your mask." And he goes, "Oh, call the police. I'm not wearing a mask." So we tend to see that behavior more in men. Hopefully, even men are getting educated, not to knock all men, obviously, but we're just seeing that behavior more. But that's the distribution. And as far as asymptomatic, I think you asked me this earlier. So initially, we did know from the data we had out of Wuhan, China in February, that only 1% of the population were asymptomatic. So now we know that's completely wrong, because of all the people that have been tested for coronavirus 50% are asymptomatic. That's 50, which is great for the people who are asymptomatic, but not great for everyone else that comes into contact with them, because they don't know they have it, and thus they are spreading it, not meaning to. And that's why everybody wearing a mask, both the person who has it and other people, really, really, really is important.
Do
And
they know
let's actually,
why? Why is it that somebody could have these exact same viral load in their body and have zero symptoms, and
and
somebody
it's
else?
actually not, it's not even the exact same viral load, because we're finding that young people, the 20 to 49-year-olds, actually have a much higher viral load, even though they are the majority of the people that are asymptomatic. So, but no, in answer to your question, we don't know why. But let me tell you a little bit about symptoms, because I had a friend who called me up and said, I was sick about a week ago, and he told me his symptoms. And I said, most likely you had corona. And he said, no, I had just really bad weakness and my muscles were really hurting. And so I don't think people really know what the mild cases of corona are like. So I'd really like to discuss that a little bit. So as far as coronavirus, it can affect anything, and the symptoms are they range and they jump around. So I had one patient who started out day one with a sore throat, just the right side of her throat being sore, and day two, the left side of her throat being sore. So it kind of jumps around. But what everybody does have is tiredness. I can't get out of bed, just getting up to go to the bathroom. I can't do my laundry. I just want to sleep. I can't get up. So this overwhelming tiredness is definitely a symptom of corona. And then this full body ache, where there's body ache. Some people who have it mild just have mild ache, but some people have such bad aches that they feel like a tractor hit them. And this isn't even with fevers or respiratory symptoms. So sore throat, this really tiredness feeling. And then of course, if you think you have it, if you have symptoms like that at all, you want to stay away from people. Some people will have a mild case. Some people will have it not feel it at all. Some people will feel it for a couple days and then it'll go away. But the people who get the bad cases on day 7 of the coronavirus is when they develop the really bad symptoms. That's when they start getting respiratory distress. That's when they feel really bad. And most of the people that go into the hospital have been quarantining at home for 10 days. So if you're lucky enough to have a short illness, that's great. But and the fevers and chills are bad. So the chills are so bad that people even break their teeth from the tremors that they're having. I mean, it can be really bad. So there's a whole range of, I feel nothing, I felt something a couple days ago, but I don't think I had it, to really bad symptoms. If you do think you have it and you're quarantining at home, it's a really good idea to, on Amazon, get a pulse ox. Just stick it on your finger. It measures your oxygenation. And if you find that your oxygen levels are 95 or above, you're fine. Even though you're feeling lousy, you can breathe. But if you find that your oxygen levels drop below 94%, it's really time to go into the doctor and get an X-ray or an MRI or a CT scan and just get checked out and get treatment. Another thing is, if you're quarantining at home, it's very good to do what's called proning, which is actually if laying on your belly. So we don't know why, but initially in China, we found out that all our patients on ventilators that were doing badly, if we got a group of people to flip them over on their belly, they did better. So if you happen to be quarantining at home and you do have respiratory symptoms and you do have a cough, and you're really feeling short of breath and not good, but your oxygen levels are fine, try to spend as much time on your belly as you can when you're at home. So, and that's called proning, and that really, really helps.
Are you finding, I mean, now that we're 6 months in, you know more, you know more to what to expect now. And so my question would be, God forbid I called you and said, oh no, Michelle, I'm feeling X, Y, and Z and I'm at home. I'm on vitamin D and zinc and
Hold on one second. Hey,
yep.
you guys, welcome home. Happy birthday, Justin.
Happy birthday, Justin. So God forbid that I started to feel some symptoms and I called you and said, okay, and I have my pulse oximeter and I'm like, okay, no, it's at 95, 90, and you're like, all right, it sounds like you definitely have it. What are we finding medications at this point before you would have to go into the hospital? Are we at a point where there are treatments that you would give someone quarantining at home at this
So
point?
that is a big topic of discussion, and you can, the whole thing is that usually when we come up with scientific data, we have years to vet it. We've only have months. So, and a lot of the science that's being done is great, but a lot of the people doing the science aren't the frontline workers. So we definitely have a difference of, what you should do, what we're seeing as frontline workers. So there is no dogma, and you should really talk to your doctor about what they recommend. And you should, but really, because there's such a range of symptoms, and since we really don't know if someone has coronavirus, so say someone had a sore throat and a cough and was a little short of breath. Well, certainly in this time, this is not flu season. We're going to think that this is corona because we think everything is corona at this point until proven otherwise. But unless you really have a loss of sense of smell and a loss of sense of taste, we really don't know 100% that you have corona. So it's really hard to give antibiotics or medication to someone unless you know for sure. And even our testing is pretty awful, which has limited everything. So say I have those symptoms and I go get tested, right? With those symptoms, definitely, most likely I have corona, but I don't know for sure. But then I go in and I get tested and it's negative. Great, it's a negative test. Really, that's awful because most likely you still have it. Of the people that have coronavirus, 30% will get a false negative test. 30%. That's an awful lot. So that means those people now think they have a clean test and now they're going out and now they're like, nope, I'm good. And maybe I won't wear my mask and maybe I don't need to social distance, but really they have it and they'll spread it again. So for those people, we suggest that they get, they quarantine. You should definitely quarantine. The CDC changed their guidelines from a 14-day quarantine to a 10-day quarantine. And then to not go back, and that's for the people that you think have it. If you actually have it, then it changes a little bit. If you have one of those cases that only lasts 2 days and you're lucky to have that, then they don't want you to go out from 7 days from the start and 3 days from having no symptoms. But if you're one of those poor people that have it, a really bad case, and you're hospitalized, then it's a whole different thing. We want you to wait 3 days until you're asymptomatic until you go out. So there's just so much out there with the coronavirus. So back to your question, should you take medicine, which I never answered because there's just so much to it. I can tell you what I do personally. So if I know someone for sure has coronavirus, like I'll give you an example for my kid. This way it's not medical, it's more personal. So Justin is starting college, and I'm packing him up to go to American University in Washington, D.C., which, by the way, he only discovered because of Temple Emmanuel and the amazing teen groups of taking him out to lobby Congress. So I sent him off to school with a pulse oximeter, and I definitely got hydroxychloroquine and azithromycin. And I got a baseline EKG on him before he left, so I knew his QT interval beforehand, because the only reason that hydroxychloroquine can cause symptoms really, or bad side effects, is if the dose is very, very high, which they did in the initial studies. Now we don't give those high doses anymore because we saw the problems that could happen. And if you have something called a QT prolongation on your baseline EKG, because both hydroxychloroquine and azithromycin prolong the QT interval even further, and that could actually lead to sudden death if you have a QT prolongation. So clearly a bad side effect, but a very, very rare side effect. So you don't want to give it unless you're really sure you have coronavirus. And so you really have to be in touch with your doctor if they feel strongly enough that you have coronavirus, even with a negative test. We are finding, though, that giving hydroxychloroquine and azithromycin early on is actually better. That the test that they did, they gave it to these patients who were really sick and almost dying, and it was too late. So we're finding, kind of like, I don't know if you've heard of Tamiflu, but it's a medicine you take when you just get a virus and you have to take it within 2 days. Same thing, hydroxychloroquine and azithromycin seem, data changes all the time, seem to help really at the initial onset of the illness. So that if you're going to get your doctor to give it to you, you want it, and you think you're pretty sure you have coronavirus, you want to take it earlier rather than
So it
later.
just shows that this got so politicized. Hydroxychloroquine got so politicized, and now so So, Trump saying, I took it myself for 2 weeks, and the news reporters are saying it doesn't work at all. And the truth is, that's not true on either side.
Absolutely.
I mean, what I've heard is, actually my mom had an autoimmune that there's a long story, but she had to take it for a while, but she was very closely monitored, because there can, at high levels, be organ issues, organ failure, and stuff like that. But it is interesting because, I thought it had been just taken out of treatment altogether, but it sounds like they're refining how to use it, or you're
Well,
refining.
the problem is that it has been really politicized. So if you want to order it as a doctor, this is the first time ever that some pharmacists will say, no, I'm not going to prescribe it. So we've never had that before, that a pharmacist is saying, no, I don't believe in it, I'm not going to do it. And then there's another camp that data is still coming out, that are using it prophylactically. So taking hydroxychloroquine 200 milligrams twice a week along with zinc. Oh, zinc is a good prophylactic thing.
I'm taking vitamin D and zinc, and my sister-in-law's sister, who's a doctor in Austin, we talked about this, but I'm taking vitamin D and zinc and some herb called quercetin that helps you absorb the zinc, and small doses of melatonin and sambucus, just every day, basically.
Right, and none of those things are going to hurt you.
Yeah.
And zinc really inhibits viral replication. So the whole thing about a virus is this, is that unlike a bacteria where there are antibiotics, viruses really don't have anything to treat it. That's why Tamiflu taken early helps. And that's why maybe hydroxychloroquine and azithromax and zinc will help early on, because it'll prevent the virus from shedding. And so what happens is that a virus attaches itself to your own cell, attacks your own cell, and uses your cell's host machinery to produce more virus, and then it explodes your cell and sheds out millions of different viruses to attack other cells.
Right.
So zinc inhibits viral replication, so it will inhibit that process, and if you get it early on, then you're really going to help with that. So yeah, taking over-the-counter things, it certainly can't hurt. And so the unofficial protocol for prophylaxis or prevention of coronavirus is 2 hydroxychloroquines a week and zinc every day. And there's no how many milligrams of zinc, there's 20, there's 50, we don't know. Taking anything is probably helpful, we think.
But you're not telling everybody go out and start taking that now. Are you recommending that to people who think that they got?
No. So like I said, I am only speaking about my own family and my own kids and my kid going away to college, because really nothing is solidified and we don't know, and it's become highly politicized and it's too fast. This is only several months. Data takes a long time. Like, for example, vaccines. So vaccines, a normal vaccine, a measles vaccine, took 15 years to make, because you have to find the right vaccine, you have to make sure it's effective, you have to make sure it's safe, and then you have to be able to produce enough of it to give to everybody else, right? So it's really hard. We're trying to speed everything up. So no, I'm not recommending anything. I'm just telling you my own personal views.
Right.
But we're going to come out, in 3 years, we're going to see what really worked and what really didn't work. But just like HIV, when it happened, you don't have a long time. People die really quickly with coronavirus if you have a bad case, and we need to try something, and we don't have that luxury of time. So different people are gonna adopt what they think, and that's why you really have to follow the guidance of your doctor. If God forbid you're hospitalized, your infectious disease specialist, your cardiologist, your pulmonologist, all the people that you're seeing in the hospital to guide you. But back to vaccines. So vaccines, like I said, normally takes 15 years to go through 3 phases of trials to make sure a vaccine works. And we're trying to get this, vaccine tomorrow. So and then we even found this other problem, is that antibodies. So if you get, and I'm going to come back to the vaccine, but so for antibodies, if you get it once, can you get it again? Well, we don't know, because it's still, very soon. We're only talking about a couple months into this illness. What we do know is that people do develop antibodies, which in the past, antibodies did confer immunity, meaning not getting it again, but we have no idea if that's true or not with this disease. But now, unfortunately, we're finding that antibodies only last 2 months in 40% of the people. So that means that if it does confer immunity, are you only immune for 2 months? That also affects our vaccines. So if a vaccine only mounts an immune response in your body for 2 months, does that mean you have to get a re-inoculation every 2 months? So because of all those things, our amazing scientists out there have had to come up with new and novel ways to create a vaccine, and that's what we're doing. So right now we have completely new ways to make a vaccine. And we have 8 different ways going right now in 10 clinical trials around the entire world, Israel being one of them, Japan as well. And what we're finding is that these beautiful scientists who for 15 years have been studying one tiny thing can now use that little knowledge they had and really apply it to this. So now we're using knowledge that researchers have used for cancer therapy in order to make vaccines and to actually stimulate our immune system so that it's a vaccine and an immune stimulation. So it's an immune booster so that we can have immunity against the coronavirus, not only for 2 months. And I really believe that this will change and improve medicine on every spectrum of every disease.
Yeah,
So it's really a beautiful thing.
I was going to say, where I can't imagine ever being in a place where we have 15 years to come up with a vaccine, you know? I don't think in our lifetime we have that kind of time to come up with, you know, an answer to a pandemic. That's just a reality. Are you hearing privately of like, when do you really believe that there's going to be a vaccine that we can count on?
Okay, so of course, nobody really knows the answer, but in the medical circles, at first we were saying it's gonna, if we're lucky, like I said, we thought 15 years, this is unprecedented times. At first we said maybe we'll be lucky if we get a vaccine out in the fall of 2021.
Right.
But now things seem to be heightened. And so it's word out, like I can't verify any of this, but
Right.
word out is that it looks hopeful that maybe in the beginning of the first quarter of 2021, there will be a vaccine. So that's really amazing, because when we get a vaccine, when everyone gets inoculated, then we can go back to our lives again.
And
Right?
the truth is, even when 50% become inoculated, the more people, the less spread. So yes, we want to get to 100%, or we're never going to get to 100. We want to get to 85%, let's say, or 90%. But the sooner that people around us start to get inoculated, the better. Right.
Right. And another good piece of news is that usually we wait until the trials are done, that we prove it's efficacious, it works, and it's safe. Just then is when you'll start making all the vaccines. And to get enough vaccine for the whole world, of course, that's going to take months and months and months. So luckily, the funding from the government has done an amazing thing where all these trials that are already advancing, the ones that look hopeful, they have been funded to already make doses of the vaccine. So now we have from now till the first quarter of 2021 that they're in mass production of the vaccine. So when the tests are done, and if it says it's safe and effective, bless you, Labriut, then we'll already have enough to start mass producing.
Yeah, I've heard of factories that are already being transferred over into vaccine factories, and for everything from the tubes to all these things are being set up. So then when the formula is created, hopefully I think there's something like 10 new factories being built in the United States right now just to produce the vaccine. But when it comes down to it, do you think, there's so many people are on different ends of the spectrum, and I'm realizing we're running out of time, but they're on so many different ends of the spectrum of, I haven't left my house since March 7th, and I don't even order, I only order my groceries or whatever. I find myself to be a little in between, which is wear your mask, social distance, and yet I'm still living my life. I've eaten outside at a restaurant if there's nobody else out there, but I also am not going, I'm not doing anything just for the heck of it. I'm not going shopping. I'm not, especially if it's not, especially indoors. So do you feel like we are at a place where if we wear a mask and wash our hands and social distance, that can be a part of our new life, and that we can, everybody was hiding, right, for a long time. And then I do think that the protests and Memorial Day and Father's Day and Mother's Day, everyone started getting a little bit more comfortable. Um, and I just would like to think that we're much more prepared now than 6 months ago. That we can sort of have a semblance of a real life if we take these precautions. But it took us having to go into shelter in place to understand the severity of the spread.
So the truth is that there's risk out there for whatever you do, and it's just varied degrees of risk. And the better you can be protected, as you said, that now we're more prepared, the better. But it would be lovely if we knew who had it. Like if you turned purple when you had it, well, then it would be very easy, right? So, but the thing is that we just don't know who has it, and since we have 50% of people being asymptomatic, the safer you are, the better. But mental health is so important. And, being with friends is so important, and getting out and having exercise is so important. So if you're really drowning during this time, do what feels right for you. Definitely be as safe as you can be. There are a whole bunch of different options out there for mental wellness. And just know that you have a whole society. My goodness, Temple Emmanuel has been amazing with all the ways to keep you busy and to reach out there. Mayor Garcetti made an app that's a meditation app, a free to all LA County residents. It's called Headspace. And it's meditation, and it's not like, if you've never done meditation or that's not your thing, don't be afraid of it. It's just a way to calm and find positivity and gratitude in everything that we have, because face it, we are so lucky. We have our temple, we have our friends, we have our family, we have our health, we have beautiful houses, we live in an amazing neighborhood. There's so much to be grateful for. And studies have shown that for mental wellness, sleep is actually the number one thing. So really try to practice health, sleep hygiene, going to bed in time, turning off all your apps. And at this point, I think watching the news too much isn't really healthy for mental wellness. So, news changes so quickly and the news stations don't have time to keep up. So the things they publish mostly are inflammatory or politicized. So really get rid of if you're having a problem, get rid of all your news apps on your phone. Stop that automatic feed from coming on. Just take a step back. Instead, get out in nature. Go take a walk at a time where there's not a lot of people out there, early in the morning, late at night. Go with a friend. I go walking with friends, and this is how we walk. We have masks on, we have earphones on and our phones, and we walk on opposite sides of the street talking to each other on our phone. We're social distancing, we're getting out there, we're getting our exercise. There's so much you can do. Studies have also shown that laughter really is very helpful for mental well-being. So watch a funny movie, and music. If you enjoy music is really, actually, it stimulates certain neurotransmitters that have to do with endorphins, which are the happy neurotransmitters. So music is really good, as probably you have found, Lizzie, right? So there's a lot we can do to be happy and healthy and appreciate what we have.
Yeah, I think finding that balance of being sad for those who have suffered, being happy that, many of us are blessed to, even in this part of Los Angeles, we don't have the cases that they do it in some other places of Southern California. But we can't take it for granted. And as you said, just being really, really, really careful is so important. But I wish we could keep talking forever and ever, but we're out of time because it's Tuesday and I have to teach Hebrew boot camp. So if Hebrew makes you get happy, you should also join every Tuesday at 4:00. But Michelle, thank you so much. People, I'll be on watching with everybody on Thursday and answering questions. And just thank you. Thank you for taking the time today.
It is so my pleasure. And, I'm part of the congregation. If you guys need anything, I'm always here. We're all a big family. And just really, take a couple moments every morning and just think of the things that you are happy for, that you are appreciative. and just stop and take some breaths and just enjoy. And Lizzie, thank you, and to the whole temple for all the goodness you've given us during this time period.
Oh, thank you so much. All right. Think about it Thursdays. I'm going to end the
Woohoo! Bye, you guys.